why we want people to test. One of them is so that we can track the disease prevalence in the community. And when the Department of Health is getting close to or over 100,000 tests a day, we have a good understanding of what the disease prevalence is in the community. What we really want people to use the at-home test for is when they are feeling symptomatic or they've been exposed. We want them to be able to know quickly if they actually are positive so that they can take the appropriate public health action and then isolate that. Both PCR and antigen tests are highly effective, but they do test different things. So a PCR test is really designed to detect any prevalence of the virus in the body, where an antigen test is intended to be able to test if there is active virus that you're shedding and you're likely at the height of transmissibility. So both tests are highly effective, they just test slightly different things, and we certainly recommend using either or depending on what you're able to get access to.
And now that the CDC has the new guidelines that you only need to quarantine for 5 days rather than 10, is that making tests in facilities like these more common or less common?
I think it's just increasing the overall demand for testing. We've certainly seen an increase, particularly in the last couple of months, for a demand in testing. Like I said, we're almost over 100,000 test results a day. And so we're glad to see that Pennsylvanians are testing. It's a core public health strategy at this time, and we encourage them to continue. We're committed to maintaining testing availability across the Commonwealth, including in Center County, and based on where the demand and need is, we're happy to provide the resources we have.
In the past several days, we've been averaging somewhere between 100 to 150 tests. That's down, it's leveling off a little bit from the post-holidays, early January time period. During that time, we were up around our maximum capacity of 450, sometimes even up to 500 tests a day here at the site.
Okay, fantastic.
I think it's a really creative one. So this is now the third AMI site that I've been at. It's the first walk-in site that I've been to, and it's definitely the first recycling center we've been at. But I love it. Just talking with some of the community members here today, it sounds like this is really a place that's convenient for the community, and that's what's most important. So it's great to be here.
Well, obviously, as you look around, I mean, it's a quite comfortable site, right? So it provides obviously everything that we like to have in terms of, you know, reliable electricity, connectivity, good parking situation. The site flows well. It's a walk-in only site, you know, unlike some other sites that have drive-through, but this is a walk-in only. But it's convenient in terms of people are able to enter on one part of the building, get processed, get tested, and exit out, you know, the back side of the building. So, you know, it's a good structure, it's a good location, easily accessible from some of the main roads, and then it just works well in terms of how people flow.
And you're all set, okay? My pleasure. We have lollipops and stickers over there.
Oh, I don't need a lollipop.
Well, the projections are always hard to judge. So we have seen a sustained increase in the last 6 to 8 weeks. That spike has been particularly noticeable since the holidays. We have seen a slight decrease in the 7-day moving average, but it's too soon to tell if we're truly at a peak. I think we are probably getting close to the peak if we're not at it yet, but I think there is still a lot of work to be done because there is a 2-week lag between case counts peaking and hospitalizations peaking, and then deaths peaking after that. And so even if we are at the peak by way of case counts, there's still a lot of work to do.